So this is the Rwenzori Health Clinic, Mariva, and we're just going to have a walk through the clinic to see how activities are going and to see the movement of the patients in the clinic. Thank you. So as you can see, as you go inside, this is our dispensary, the triaging room, and the waiting area. So we normally triage from here. Then after triaging, patients come and sit here. Then after sitting here, we also get drugs from the dispensary. So from the dispensary, from the waiting area, if there are many, we make them sit inside. If there are not many, they can occupy this place. So from the waiting area, this is our consultation room. So we expect from the consultation room to consult patients. After consult patient, examine them. After examining patients, we also have to send them to the laboratory. So from our consultation room, then we go to if at all patients are many, there is a church which normally helps us with the seats. Patients are many because our waiting area is small, so patients have to sit under this. They have to sit in this sunshine as they are waiting, either to be called in the consultation room or to be called in the laboratory. But ideally, we use this place and there as our waiting area or our consultation, our triaging place. Then from the waiting area, from the consultation room, they come to our laboratory. So this is where our laboratory is done. We do majorly microscopy for now and serological tests. We have a variety of tests that we do here. We do MRIDT for malaria. We do WIDO for typhoid fever. We do H. pylori for peptic ulcer disease. We do TB LAM for tuberculosis. There's XCG. We do syphilis test, and we also do prostate surface antigen screening. So if at all, after getting the samples from the patients, they have to also wait until the results are ready. So after waiting, the books are sent back to the clinician's room, which is our consultation room, to be awaited for explaining the results, number one. Number two, writing for them the drugs. Yes, so from the clinician's room, it will, one, determine whether the patient will be outpatient, depending on the signs and symptoms. Two, whether the patient will be monitored at the clinic. We monitor the patient at the clinic if at all we think they cannot benefit well from oral treatment. Yes, so if we admit someone then this is our admission room. Specifically, this is where we monitor patients from. So these are the beds, and we make sure that our patients are protected. They have mosquito nets. Two, we normally monitor them. We see that the beds are well made to avoid cross-infection. We see that after admission, our bed sheets are cleaned. Then after cleaning, it's when we can allow another patient to come in. So this is where we normally monitor our patients from. So we also have another small room where we feel it is not safer for women and men to mix up. So we reserve the small room because men are not easy. They have a very poor health-seeking habits. For them, we only reserved them three beds. So these are the small beds that we made using the local welders to help us and improvise with us these small beds for this. So men, we monitor men here we avoid to make sure they mix with women because of privacy. Yes. So we have also a small room where we put, which is our drug store. So this is our drugstore. Because of space, our staffs share these rooms. Yes, because of the space, this is where staff sleeps. Yes, and this is where we store drugs. Yes, it kind of looks unsafer, but that's how we do it. That's how we improvise. The space is little, is minimal. So these are our drugs in boxes. We make sure we raise them from the ground to avoid absorbing moisture. Yes. So ideally, our space is very limited, whereby outside the congestion is too much. So behind, we also share. I think we can pass behind and see. Yes. Yes, we can also see our washrooms, right?
Where are they?
Behind.
Oh, we haven't seen them.
Okay. So as we speak that we share the building with tenants, this is what we mean.
Oh, Ronald, you want to just mention this one?
Wow. So this is where Esther stays, this room. It's where Esther stays. Yes. So behind here is our toilets, all the washrooms. And so these are our good neighbors. We share the same building with them. So behind here is this is our pit latrines. Yes. So we share pit latrines with our tenants. So.
And this is where they do urine testing?
No.
Patients?
No.
No.
Yes. So here it's it's where we patients come here to ease themselves. So here when you have paper bags, non-infectious waste, we also burn them from here. So this place is not a good place because it is shared by environment. Yes, share it. It is always hard to clean it. Yes. So this is the part of it of our center. So this is also our room behind of it. Yes. So ideally that is the space we occupy, and this is our operation area. It is in the Mariba Feeding Center. So yes.
Great.
Good.